I'm Allison, and I am the mother of 2 children, and my son, Ben, was diagnosed with autism when he was 2, and throughout that time, we've just had a tremendous roller coaster of insurance battles as we work to give him the care that he needs. When we look into some of these options for therapies, insurance was saying, no, we don't cover that. So as he was getting older, his rages seemed to increase dramatically. He would get angry and just whatever was near him, he would take and just make sure that he destroyed it. But now he was stronger and he was physical. He broke my nose when he was in first grade because he got angry. My husband would get him in a big bear hug and restrain him, and he would eventually calm down. But I didn't have the strength to do that, so. At first I was sad because you want your children to have the best life possible. And I said to my husband, I can't do this anymore. Sorry. I said, I can't do this anymore. And we had tried all sorts of doctors and nobody knew. And the only thing we hadn't tried locally was Mott's Children's Hospital. A pediatric psychiatrist met with us and said, this child needs to be hospitalized, but we don't have a bed. And in probably 3 to 6 months, we'll call you and you can bring him back when there's a vacancy. And I've never felt so helpless in my entire life because I thought, my first thought was, how can we endure this, for another 3 to 6 months? But also I thought, how do I know that my son will be around in 3 to 6 months? It just seemed so desperate. It was just getting worse. The head psychiatrist from the floor came down and said, I, in good conscience, can't send this child home. It was exactly 26 hours by the time we were admitted. And I have to say, in my 53 years of life, that is the single hardest thing I've ever done, leaving him there. So after about 10 days of being hospitalized, we were told that insurance said that they wanted him discharged, that they felt his stay was sufficient and that it was time for him to be discharged. So shortly after Ben was discharged, I received a bill in the mail for $147,000. I was beside myself and spoke to numerous people. If they weren't going to pay for it, why are they even involved in deciding whether or not he's there? My husband says there's type A and there's type Allison. I take copious notes. I keep impeccable record keeping. I have a file for everything. I don't know how many, there's an appeal, and then when that's declined, you can appeal again. And I was doing all that. I sent letters to senators, congresspeople. This honestly turned into almost a full-time job in itself. And it took close to 2 months after Ben was discharged to finally get that approved. I truly think that it took 2 months because they were hoping I'd give up. What we are seeing is that each year our insurance company covers significantly less than they did the previous year. Makes you think. We need the Mental Health Access Act, HB 4707.